Foremost, I would love to have Congress see urgent care with a top-of-mind awareness that we are the tip of the spear in the outpatient realm. We are the counterparts to emergency rooms and to our hospitals. So early inclusion in national efforts would go a long way, and focus on offloading those inpatient hospital burdens, as we have been in the urgent care, would just be amazing.
You get paid $16 and change for giving a vaccine, and that includes phone calls to and from patients to schedule them, doing all their HIPAA documents and consents, going over the CDC pre-vaccine checklist with them, administering the vaccine, observing them for 15 to 30 minutes afterwards for possible reaction, and then scheduling for their second vaccine. We're not allowed to charge for a nurse visit for this, just the $16 for the administration fee, even though going over that medical checklist and watching them after the vaccine is administered for a reaction, that's definitely a nursing function. So we lose money on every shot we give, but we do it as a community service.
Another more nuanced issue where some of the payers in a lot of states will give you a flat rate for your service, whether you were seeing someone with a broken bone, whether you're seeing someone that needs stitches, whether you're seeing someone who just has the sniffles, they pay you the same amount per visit. That's what's called a global rate. And in a lot of those cases, whenever COVID happened, and you just saw our increase in costs, a lot of those payers said, you're still going to get your same global rate. We want you to eat all of those costs. We still want you to provide COVID tests, but we're not going to pay you anymore. Or we still want you to do, whether it's a vaccine or see all of our patients in these more, clean and different environments, but we're not going to pay you anymore for your increased costs. And so what we would love to have happen is what's down at the bottom of this page called a bill above, which is you could have your global rate for your office visit, and then for COVID tests in particular or the vaccine to get an added reimbursement for those. We have been successful doing that with some of those payers. It'd be nice if it was mandated that any global rate contract would have these extra reimbursement items for the COVID specific, pandemic specific responses, whether they be tests or the vaccines. That would be helpful for all of us so that we can continue to do, as Roger mentioned, he's doing it but at a loss. But if we want this to survive, we need to be able to continue to do it and at least break even so that you have all these access points open and helping all the local communities.
We're open 365 days a year, mostly 12-hour days. We are in our communities working for the safety of our staff, of the individuals in the communities, for businesses, schools, daycares. And we are here and hopefully demonstrated how we stepped up and what the urgent cares provided during the pandemic. And please know we're here for whatever is next. We're filling a vital role in healthcare.
We have amazing colleagues in the departments of health across this country, but in leaving it to them to figure out how we can best report and record and register for all these processes, it really puts an unnecessary strain on them, some of whom are my friends, who I see, they struggle with trying to reinvent the wheel, 50 different ways across 50 different states or more. Here in New York, for example, there's a difference between the state Department of Health and the city Department of Health, each doing their own thing, each reinventing the wheel for themselves. When we standardize in medicine, we save lives. When we standardize in medicine, we can have early deployment, early responses. So my request to Congress is to please, to the best of our ability, creating one national standard, one national set of rules, set of changes, whatever they may be, would truly benefit us as a healthcare system across states.
Consistency is important, and I think JD mentioned that earlier. So whether it is consistency in how we report, We are across multiple states and multiple DPHs, and they do all have a different way that they want us to report in our positives or the vaccines or whatever it is. So a consistent platform with technology behind it would be fantastic, and a consistent approach from the payers. I think one of the themes has been, even if Congress mandates that payers must pay, even in the most recent FAQ that came out, that the payers interpret things slightly differently, and it's still a struggle for all of us to have to work with each payer in their interpretation of what they think it means. So clarity and consistency across the country, I think, would be exceptionally helpful from our perspective.